Thanks, Hannah. Now, I know you run, Hannah, and I have dancer knees, and sometimes the weather, you can feel those aches and pains, right? Well, last hour, we told you how the change in barometric pressure can actually have a huge impact on the amount of joint, muscle, and aches and pains you feel right in your bones. And if it's chronic pain, it can be even worse. Our own Sharon Melton has more.
So the pain in your body's acting up just as the barometric pressure outside changes. You feel it in your knees, your back, your joints, and your bones. What do? Get moving.
We need to start exercising on a regular basis. We need to eat properly. We need to avoid, like you and I talked about back in November, about foods that were bad and inflammatory foods that you know can cause inflammation in the body. We want to avoid those things. We want to make the body as healthy as it can be, because at the time that it becomes under these other stresses, the stressors that later in the fall, like we're speaking about now, the body will be much better adapted at handling those stresses. So that's the first thing, would be proper diet and proper exercise. And then, the things that come around specifically in the fall, like less sunlight. We want to make sure that we do get out when there is sun. We want to be exposed to the sun for the vitamin D, as you said, for the pandemic, because we know that vitamin D is also important for preventing our body from succumbing to that virus. But that also has an effect on our bones. And again, when we talk about injuries to joints, if our bones are already arthritic and we throw in less vitamin D is less in the body, we have less proper minerals in the bones, then you're going to accelerate the arthritis in the joints. So those are the things that we work with also.
You can get past that and continue to live without pain. Is that true?
Absolutely, 100%. You are correct. But in times of when we're in the climate becomes very humid, there's changes in our blood that occur. So I always say stay very hydrated, because that can help the blood flow the way it should, because humidity sometimes causes the viscosity of the blood to diminish. And so if we stay hydrated, we then can keep our circulatory system moving the way it should. So in a natural means, even with you not coming to my office and see me, but your body, the way it was intended to work through an innate ability to heal itself, will work more efficiently. It's like putting good gas in your car, right? If you put really bad gas, it doesn't work as well. Put the best, the 93 octane, you're much better off.
I love that. But the most important things, of course, nutrition, exercise, hydration, and come to see someone like you, right?
Yeah, I think that's, I like number 4 really well. But no, I think absolutely. And if we educate those patients along the way, they can really learn to maintain this on their own. And that's what we're really excited about, is self-empowerment.
I like that. Self-empowerment. No prescription for that.